Eating grilled meat in pubs is part of daily life in Kenya's capital, Nairobi. Selling it is big business. That all ground to a halt when the government ordered restaurants closed to prevent the spread of the coronavirus. All the grills on this strip have closed. All the workers have been laid off.
All is not well. We must adhere to the measures, but our customers are scared to come for even takeaway. We have nowhere to turn to for help.
The grilled meat traders here are among millions across Africa who've already lost their livelihoods because of restrictions on movement and trade. Shoppers in Kenya's supermarkets have to keep distance and sanitize their hands. But shops like this are the domain of the middle class, which in most African countries is tiny. Crowded markets like this are more normal. There simply isn't space for people to keep distance here, and it will be impossible to enforce it. But for the people that trade in places like this and people that buy their food here, they don't come here in the daytime, they go hungry in the evening. And it's the same story for millions of people in cities across the continent. The government of the Democratic Republic of Congo has locked down the central commercial district of its capital, Kinshasa. But in most of the rest of the city, of about 12 million, people are still out and about, trying to trade.
If they don't go out to find work, they won't find a means of livelihood. So that becomes a significant constraint to the containment measures the government is instituting elsewhere. And in the absence of social protection, we're going to see upheaval.
Step away from me. South Africa's army has been accused of rights abuses in trying to stop any upheaval when it enforced a lockdown. The country's recorded more cases of the virus than anywhere else on the continent, possibly because it's carried out many more tests. Its lockdown seems to have succeeded in slowing the rate of infections. In much of the rest of the continent, hospitals and health ministries have recorded relatively low but sharply rising numbers so far. With many living in crammed conditions like this slum in Nairobi, health experts think the worst is yet to come.
If these interventions around testing, around isolation, around hygiene practices, around staying at home, but also taking care of the social needs of the population are not going to be thought out clearly, then we are going to see a steep rise, and which will bring in a lot of deaths.
As long as markets are busy, like this one in Nairobi, it will help the virus spread. Empty markets mean hunger and social unrest. African governments face difficult decisions in the weeks ahead. Millions of people will face the consequences. Malcolm Webb, Al Jazeera, Nairobi, Kenya.